Our next speaker will be the lovely Faith Niyi Awolesi, who is a rising senior at Jesse Patel High School. And then today, Faith will be sharing her project titled Examining Facilitators and Barriers to Screening for Trauma and Social Needs in the Adolescent Population. And then something to know about Faith is that she loves watching cartoons. So take it away, Faith.
Hi, thank you so much for that introduction. My name is Faith Niyi Awolesi, and this summer I worked on a research project titled Examining Facilitators and Barriers to Screening for Trauma and Social Needs in the Adolescent Population with my mentor, Dr. Dana Long, and the Find Connect team. Adverse childhood experiences and toxic stress have a profound effect on the health and well-being of children. Alongside ACEs, social adversities like poverty, discrimination, etc., are linked to toxic stress and poor health outcomes. Social needs platforms like Find Connect, with the service of a navigator working longitudinally with families, have been extremely successful in resolving unmet social needs and decreasing the risk of emergency department visits. The Find in Find Connect stands for Family Information and Navigation Desk, and it's a tool that addresses social and environmental factors affecting children's health outcomes. But adolescents ages 12 through 17 within the UCSF health system are not utilizing this resource despite its effectiveness. The objective of our project was to determine the challenges to enrolling adolescents, to identify facilitators to enrolling adolescents, to explore possibilities to scale and expand opportunities, and to outline ways that Find Connect could be improved to serve the adolescent population more effectively. My research project was a mixed method study, including both quantitative and qualitative data. Semi-structured interviews with 5 school-based health center staff were conducted and transcribed verbatim to find themes. The quantitative data was collected from Find Connect's database, and the total number of enrollments on the platform at the time of data collection was 4,157. The number of adolescents enrolled without a caregiver was just 61. After data collection, some of the barriers or limitations to enrolling adolescents included language not tailored to adolescent users, lack of relevant or sufficient resources for adolescents, and lack of specific surveys geared for adolescent needs. Some facilitators to adolescent enrollment included in-class presentations by navigators, one-on-one interactions with a navigator, the action plan provided by the platform that guides communication, online formatting with the aid of Zoom calls and private chats that add a layer of privacy for the adolescent, and follow-up meetings or calls with navigators that aid in fostering a relationship between the navigator and the adolescent. The priority opportunities identified in the adolescent population in Find Connect are shown in this graph on the right. Food and activities in blue and red are the 2 most sought after resources identified on the platform, but the interviews have revealed that jobs are actually the most sought after resource by adolescents. This can be seen in the orange for other, and since it's not a dedicated category on Find Connect, there are some limitations in terms of surveys and screening when it comes to assisting with that specific resource. We can also see from the total number of enrollments in Find Connect by age group, which is on the graph on the bottom, that the adolescent population is minuscule compared to the pediatric population in Find Connect. This number also includes adolescents enrolled with a caregiver. If that category of adolescents enrolled with a caregiver is removed from that 812 right here, the adolescent enrollment will be just 61. This can be attributed to the fact that Find Connect has been mainly used in the pediatric population for the past 5 years, and it's just being utilized in adolescent clinics. With the results found through this project, some recommendations moving forward for the social needs platform Find Connect are specific surveys made for the need of adolescents, adolescent-specific resources like jobs and activities, optional surveys or surveys that can be filled out later should be used instead on the platform to ensure that the time in between classes used for enrollment is used to address adolescent needs. Some limitations to this research project were that interviews with adolescents were not included in the qualitative data of this study. A limited number of interviews were conducted due to the lack of time, and Find Connect's launch in the adolescent clinics coincided with the pandemic, which limited the ability to work with adolescents in person. This study is important and timely because school-based clinics have begun to implement Find Connect in the provision of care to adolescents. And by making the necessary changes or updates to the platform, adolescents will be able to gain all the benefits that the pediatric population has seen from its implementation in the last 5 years. Thank you so much to my mentor, Dr. Dana Long, the Find Connect team, our Tanisha Marina and Alejandra, the school-based health center staff, for their help in the qualitative data of this study, and the COI team. Thank you so much.
Well done. Very interesting work and well needed to be extending to the adolescent population. What kind of questions do we have for Faith this afternoon? I'll start us off since we're waiting for our friends to come up with some other suggestions. So what do you think are the specific needs of the adolescent population that would be needing to be addressed through FIND?
Yeah, so through all the interviews and my work with the platform so far, I've noticed that the platform is mainly the language especially is especially for caregivers. So it's important for us to find specific surveys that can help adolescents with maybe like school needs, like with tutoring or like jobs, because we noticed that that's what adolescents needed the most, and just like food and activities. So those things specifically that adolescents need that caregivers might not necessarily ask for or need through the platform need to be like fleshed out and actually added to the platform to ensure that adolescents really get all the benefits from having a navigator and this platform.
Interesting. Vanessa, you have another question?
Yeah, I saw that there was like 60 adults or so that were enrolled. Are those the caregivers, or are those like patients that are just above like 18?
Yeah, those are just patients above 18 that are not associated with any pediatric patients.
Got it.
Denisa?
Thank you. Hi, Faith. Great job on your presentation. I was wondering if you had a favorite part of your research experience, and yeah, if you had could speak to that at all.
Yeah, I think my favorite part, everything has been really great so far, but my favorite part has been talking with all the adolescent clinic staff and the school-based health center staff, and just hearing about their stories with working with adolescents and, finding out what adolescents need and having to work with them, directly, helping them call different clinics or different resources to get help. And I think that's just been really great, like hearing their stories and hearing how much they've impacted adolescents in high schools and in adolescent clinics. Thank you for your question.